Newsday continues here on One News Now. I'm Charles Lejano. The Food and Drug Administration defends its decision not to recommend the use of Sinovac shot for healthcare workers. Speaking with Radyo 5's Ted Filon, FDA Director General Eric Domingo explained that while the vaccine has a good safety profile, its efficacy rate may drop when used on frontline health workers who are constantly exposed to COVID-19 patients. Domingo noted, though, that health workers who do not want to wait for the arrival of other brands still have the option to get the Sinovac shot, as it is still 50% effective. Still, the FDA says frontline health workers must first weigh the benefit of the vaccine and its risks.
Nakita natin na kung ikaw ay isang doktor o nurse na nag-aalaga ng COVID-19 patient, bumababa pa ng konti yung efficacy niya to 50.4%. Kaya po sabi nga namin, baka po dito sa grupong ito, baka hindi po ito ang best vaccine. Option pa rin naman po siya. Pero syempre po siguro, we have to weigh the benefit at saka risk for each and everyone.
The World Health Organization is slamming high-income countries for cutting deals with vaccine manufacturers that, quote, undermine the deals already made by its COVAX facility. W.H.O previously reduced the volume of COVID shots, which promised certain countries, including the Philippines, citing shortage issues. The group says there wouldn't be a global vaccine shortage if richer countries weren't hogging the supply.
If there are no vaccines to buy, money is irrelevant. Even if we have the funds, we can only deliver vaccines to poorer countries if high-income countries cooperate in respecting the deals COVAX has done and the new deals it's doing. This is not a matter of charity. It's a matter of epidemiology. Unless we end the pandemic everywhere, we will not end it anywhere.
We have an extraordinary...
Dr. Anthony Fauci of the U.S. National Institute of Allergy and Infectious Diseases echoed these statements. He said world leaders can only respond to outbreaks properly if they share resources equitably.
We have an extraordinary challenge, and the challenge is that clearly we need to get vaccines produced and distributed in an equitable way, not only in the United States, because it is clear that each country must take care of their own, but also the equitable distribution, as mentioned by Dr. Tedros, of vaccines so that we realize that this is a global pandemic requiring a global response.
Digital COVID-19 vaccine passports are being touted by political and business leaders as a way to revive international travel. But some are saying this is a dangerous idea. Bloomberg's Ian Marlowe has the rest of the story.
As millions of people around the world get vaccinated against COVID-19, political and business leaders are talking about vaccine passports as a way to try and get life back to normal. Here's what you need to know. So what's the idea behind vaccine passports? There's a lot of people out there, including governments that rely on tourism, who want global travel to resume, and they want it to resume as safely as possible. So there are a lot of people out there that think vaccine passports are the way to make that happen. At the moment, a lot of countries and airlines require you to show proof that you haven't been infected with COVID-19 before you land, but there's no global standard and regulations vary from place to place. The idea of a vaccine passport would be to create and provide travelers with an updated, modern version of the yellow card that tracks your inoculations over time. That would allow border agents, immigration, airlines, to all have proof that you were vaccinated before traveling and have some kind of modern digital system where those things can even be verified ahead of time. So who's actually developing vaccine passports? There's a number of initiatives out there. There are some being pushed by international travel organizations that would help airlines and border agencies integrate the different requirements for different travelers around the world related to COVID-19. There's some from the World Economic Forum, which is working on the Commons project, which hopes to have a sort of smartphone-based digital app that would have a sort of global standard proving that you had been vaccinated. vaccinated. And there's other ones like Israel's Green Passport, and there's one in the UK that would integrate with the National Health Service. There's only a handful of private companies that are saying they require proof of vaccination. UK-based Saga Cruises is saying that people will need vaccine proof before they're allowed on their ships. There's also Qantas Airways, the Australian airline, whose CEO said that at some point in the future they do hope to only be flying people who have been vaccinated. But at the moment, it's still a bit controversial. You know, people are a little bit cautious to say we're going to limit people by a vaccine or by vaccination. While the WHO does not recommend vaccine passports at the moment, they've previously recommended against immunization passports, which would prove that the bearer has some kind of antibodies against COVID. But they basically recommend against these passports for two reasons. One is that people who have been vaccinated can still carry COVID, so they could still technically spread it. And the second thing is that vaccines are in short supply. So if you offer vaccine passports to people who have been vaccinated, not everyone's going to be able to get one because vaccines are limited both by how much your government buys and within each country who's being given the shot yet. There's been a lot of research over the course of the global pandemic that's shown COVID-19 has really hit communities of color hard. It's hit informal sector workers in the developing world. It's really just had an unequal impact across the world and really exacerbated existing inequalities that were already out there. Some worry that vaccine passports could effectively create a sort of new global elite of vaccinated travelers who are free to cross borders, while other people who aren't as lucky or who happen to live in poorer countries may be disadvantaged or further disadvantaged as a result of not having access to one of these vaccine passports.
We'll be back with more stories after a quick break. Keep it here on One News. You're still watching One News Now. I'm Charles Lejano. Economic suicide. This is how the Health Department's Central Visayas office described the proposal to revert the region's community quarantine to a stricter status. How's the office planning to justify why Region 7 should remain under MGCQ? Let's find out from W.H.O's chief pathologist, regional spokesperson on COVID-19, Dr. Mary Jean Loreche, who's currently on the line. Doc, good morning. What can you say about these calls for another strict lockdown? How is the COVID situation there in the region?
Hi, good morning. Thank you so much for inviting us so we will be able to discuss what's happening here in our place. Yes, it will be economic suicide if we will be placed on a stricter community quarantine status. Currently, we know already that our cases are actually in the triple digits, but the past 2 days, you will also notice that it has not increased higher than the previous week. So we have tried to maintain our number of cases as to where it should be. Secondly, with the active contact tracing and even up to the third generation, the contact tracing is already ongoing. We are also isolating everybody that were identified together with those that we have found out to be MOCs or the mutations of concern positive individuals. So basically, I believe we are okay here. Our critical care utilization, our hospital utilization is in 50%, and the safe zone that we know is 60%. So far, so good.
All right, thank you for that, Doc. But then could you elaborate on the region's COVID-19 data and how does this compare with what's happening in the capital?
Well, during our meeting last Friday, we were shown the data from Central Office, the Epic Bureau, and we were questioning some of the data that they came up with, like the attack rate, positivity rate, and the average daily attack rate, including the CFR. And so we requested for the Epi Bureau in Central Office to synchronize with our data on the ground, because I believe that the data they get is taken from the CDRS and the COVID Kaya registry, and these are not the validated and verified data as yet. So we requested that our data, they have to look into our data so that we would be able to synchronize both data from national and from the regional.
All right, Doc. What I'm hearing from you is that everything's okay so far in your region. But then, when would a lockdown be considered? Should more mutations or variant cases be detected, or what other parameters are you looking at before considering a shift to a stricter quarantine, if ever?
All right. So the first thing that we are, part of what we are looking into would be, first, the critical care utilization rate has to be taken into account. You may have an increase in the number of cases, but the hospitals are capable of handling them. Secondly, which we do have capabilities. Second, our temporary treatment monitoring facilities and isolation facilities are actually only occupied by 30 to 40% of the total bed capacities allocated there. So that's good. Third would be our testing capacity, meaning to say the more we test, the more cases we find, so the higher the positivity. But then again, you have to look into this very clearly that most of these who are positive, like for our total active cases of 3,000 plus, 85% of that are asymptomatic. So these are not cases that are brought into the hospital, but rather are quarantined in the isolation facilities. And fourthly, we have to also look into the activities of our emergency operation centers, meaning to say that our EOCs being so functional and efficient, they are very aggressive in the contact tracing. So the more the contact tracing of the sector, the higher the numbers will go up. So I'm again quoting that our asymptomatics comprise 85.9% of the total active cases. And currently, what are the measures that we are implementing? First, when we were in the meeting last Friday, and the lockdown and the strict quarantine status was floated around, we requested that we given 2 weeks, so we will be able to assess in which areas we would be able to improve upon. And so we were given 1 week, and that 1 week will expire this Friday when we will have our meeting. So the first thing that we did was to meet with our LGUs, our providers, our leaders, and we brought that issue to them, and we guided them. So number one, they will have to be stricter. Like, for example, there is no an alcohol ban in one of the LGUs, one of the highly organized. The quarantine plan is again being implemented. Those non-essential agencies or establishments will have to be curtailed for now. So we believe that that's one aspect. Our LGUs are very cooperative and, with us in this matter. Secondly, we have also strengthened further our border controls. When you go in and out, you will have to be able to present your quarantine passes, so we will know that you are truly going to where you should be going. Third, we are also talking to our stakeholders, like, for example, the establishments. Because at the end of the day, this is not a fight of the agency alone, of the Department of Health or of the LGU. It really is, we have to look at it in an individual level, wherein a person will have to take full responsibility of his actions. So if you don't want to transmit the virus, you take care of yourself. If you do not want to get admitted, then you have to cover yourself with a minimum public health standards. So all of these are being reviewed, and we think
Thank you. Well said. That was Dr. May Jean Loreche, Chief Pathologist of DOH Region 7. And those are the top stories of the hour. Join us later at 1 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on the Signal Play app. Just register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Charles Lejano. We are One News.